Here is your stem.
Okay.
Just 20 seconds left. Just a second, please. All right. So if you've read and understood, considering it history taking station, please begin.
Hello.
Hello.
Yes, I'm Dr. Mahir, one of the surgical doctor here. Can I confirm your name and age, please?
Hello, Dr. Maher. I am Jack. I am 56 years old.
Okay, Jack. Is it okay to call you Mr. Jack?
Yeah.
Nice to meet you, Mr. Jack. Today I have been asked to ask you a few questions regarding your health. Is that okay with you?
Okay.
Okay, could you please tell me what seems to be bringing you here? What's the problem today?
Yes, I feel my water work becoming red in color last 5 weeks.
Your
All right,
pee. Yes,
I'm
continue.
very sorry to hear that. I'm very sorry for the color of your pee. I think that you are really facing difficult time, right?
Yes.
I'm very sorry for that. Could you please tell me about this suffering?
Yeah, actually, I noticed this. My pee is becoming bloody like color since 5 weeks. But the most important also, there is a pain in my loin since 2 days back. Also.
All right, I'm very sorry for that, Mr. Jack. Before we just go further, could you please tell me is it all the time there or it's come and go? This
Yes, it's
changing color.
all the time, the same.
And is it
Since
red
5 weeks.
red like fresh or dark color?
You know,
Is it
Dr. Mahal,
light, dark?
it is I think it's a blood. I think it's a blood.
Yes. All
It
right,
mixed
all
with
right.
my urine. Yeah.
All right. Is it in the beginning or it's come at the end or all through the urine, the pee?
All through pain.
All right. And is there anything make it better?
Nothing.
Anything make it worse?
No.
And did you notice that you eat beetroot recently?
No.
Okay. And can you tell me, is there any difficulty in passing pee or any pain with while passing pee?
No, I don't have pain for any health investment.
And is it take longer to pass your pee?
No.
And do you feel that you are or notice that you are rushing so often to the loo?
No, it's the same, but only the color is changed. It's become
All right.
blood. I passing in blood.
All right. And is there any tummy pain? You told me,
No.
right?
No. I have a loin vein, left loin vein that's going down to my scrotum.
Okay. Okay. Is it always there or it's come and go also?
This vein coming and goes.
And when was this side or loin pain started?
Since 2 days.
2 days. Okay. And can you tell me, is it start gradually or suddenly?
It's suddenly.
And can you describe this pain for me? Is it colicky or sharp pain or the aching pain?
It's sharp, bulky in like vein in my loin.
All right. And is it going anywhere, or is it at the same side?
Yeah, it's going to my private work.
All right. And can you tell me, is this anything make it worse, this pain,
No,
or better?
no, the same. Since 2
All
days.
right. And if I ask you to score this pain for me in a scale from 1 to 10, with 1 being mild and 10 being severe, how could you score it?
When it becomes 7/10.
Oh, I'm very sorry. This must be very difficult for you.
Yeah.
Could you please tell me, do you have any coming back to your pee? Is there any clot or any
No,
meat
this is the
or
only this is just blood with the urine.
nothing come out with it, with be like clot or meat?
No.
All right. And do you have any fainting
No,
episode of fainting or feeling tired recently?
no,
And do you have any feeling that you are aware of your heartbeat?
no,
All right. Do you have any weight loss or loss of appetite?
no,
Do you have any fever?
no,
And do you have any trauma to your tummy or to your private
no,
parts?
no.
All right. And could you please tell me, do you have any previous medical illness?
No.
Anything you are seeing your GB for? Any illness?
No, I didn't. I
Do you
don't
have
take
any
any.
previous episode that you have bleeding like this or blood coming from any side?
No, it's the first time for me to notice
Oh.
this color and passing
All
through
right.
here.
Yes. All right. And do you have any now any blood coming from other side other than your pee?
No.
And do you have any previous medication or any medication that you are taking regularly?
Good,
Yeah,
thank you. Can you summarize your history now?
All right, today I took history. Thank you very much, Mr. Jack. I took history from Mr. Jack. He's 56-year-old. He has 2 days history of colicky, loin pain that's radiated to the groin,
Yes.
and it's more severe. And he have also a 5-week history of haematuria that's coming all through his urine. And
Yes.
yes.
Any history of weight loss? Any history of stream, urine
he don't
stream
have
being
history.
affected? Okay.
Yeah, he don't have history of urine stream problem or pain with micturition.
Or the weight loss. So
yes,
what
or
are your
weight loss.
provisional and differential diagnosis?
Yes, my provisional diagnosis is that this patient could have bladder or renal cancer.
Yes.
I could also consider a urinary stone.
Yes.
Because of the colicky abdominal pain.
Yes.
Loin pain, and also I could consider urinary tract infection and any other ureteric tumor
tendencies.
or any
All right.
bleeding disorder.
Good. Please tell me what investigations would you ask for?
If time would allow me, first I would complete my history by asking about the drug history, any blood thinner he is taking, and also asking about the family history of any renal disease. I could also ask him about the idea concern and the social history, the idea concern and expectation, and then ask systemic review.
Good.
Regarding my investigation, I could request full blood count, coagulation profile, and also I could request for state-specific antigen, because one of my differential is that he's having benign prostatic hyperplasia. And I could also ask about, I could also request ultrasound abdomen and or CT abdomen or CT KOP. And I would request urine analysis or urine culture. Urine culture.
Yes.
And then I would go to do cystoscopic examination, which could be diagnostic and therapeutic at the same time. It could take biopsy, and it could do proceed to do resection if it's localized
Good.
growth. Yes.
Very good. Okay, thank you.